I am really excited to share this emerging trend and new technology for our profession. You could reach me on Facebook at Imagine MSK Ultrasound to dialogue and converse about all things musculoskeletal ultrasound. These are my disclosures. Again, you can reach me at Imagine MSK Ultrasound. And in fact, I'd like you to do just that. I would like you to imagine. I'd like you to imagine at the end of your orthopedic evaluation for your patient, either for pain, strain, or sprain, that you immediately were able to consult with a orthopedist to have access to higher level imaging, x-rays, CT scans, or MRI scans. I'd like you to further imagine that you had the skills to be able to perform a mini x-ray, a CT or an x-ray in your clinic in 10 to 15 minutes, all without having to wait for referral, authorizations, or 2 to 3, sometimes a month before you get some of those scans. Well, that is exactly what you have in point of care musculoskeletal ultrasound. Well, what is it? Let me back up a little bit. I want to encourage my colleagues that you can learn point of care musculoskeletal ultrasound today. Other professions have been using it for over a decade, mainly orthopedists, sports medicine. We stand on the shoulders of rheumatologists as well. And even the pioneers in hemophilia have been using MSK ultrasound for over 7 years. This is where I learned point of care musculoskeletal ultrasound. And as was mentioned, I had a goal of mine to pursue a physician level board certification. And of the many things that I've done over my career, this has been probably the most exciting thing that I've been able to pursue, and has just re-energized my assessment skills and ability to help my friends and colleagues and patients. So I am here to share this cutting edge technology with you, MSK imaging, to promote its use and to encourage you to learn point of care MSK ultrasound and bring it to your practice. So you may be asking, what does it take to use point of care musculoskeletal ultrasound? The fascinating thing is it takes no certification. So access to it is for every licensed PT. However, it takes a lot of dedication, actually some compulsion to learn it, and the love of anatomy. You need the access to an imaging ultrasound machine. And let me just point out right here and now, we are not talking about 1.5 watts per centimeter squared ultrasound, therapeutic ultrasound that we have been using for decades. Think baby ultrasound. Think baby ultrasound where you've been getting an image. It is 200 times less the amount of energy that we're using. Even a old vascular ultrasound hiding in the closet of your hospital will work where you could start learning. They range anywhere from $5,000 to $80,000. And all you need is some gel and start scanning. Again, there are no training requirements to use musculoskeletal ultrasound. There are, however, lots of recommendations, training, etc. There's a lot of chatter amongst the professions as far as training, minimum standards, and things like that. But what is required is your physical therapy license. And you already have the qualification to evaluate, to test, to assess, and come up with your physical therapy assessment and or PT diagnosis if you're comfortable with that term. Now, the ultrasound imaging will be an extension of your PT exam. Now, what we're not doing is we're not performing medical diagnosis. We're not diagnosing lumps or bumps or trying to identify DVTs in the knee. And we need to stay within our practice as a physical or physiotherapist. So how do you become competent in POCUS MSKUS, or point of care musculoskeletal ultrasound? Basically, practice, practice, practice. It's like a foreign language. You need to review your anatomy and learn one section at a time. And over time, you'll learn to identify normal sonoanatomy, and then you'll start to identify what is abnormal. So is the sky the limit? Well, there are limitations to musculoskeletal ultrasound, and I'll point out a few. Well, superficial structures are best. The spatial resolution can be up to 3 times sharper than an MRI scan. Deeper structures are more fuzzy, and it's poor and impossible to look at internal structures, such as looking through bone, the ACL of the knee, or the spine. That's where an MR or CT can look inside the structure. But musculoskeletal ultrasound is best at superficial structures, but it's not bad at looking at the hip, but you need higher powered equipment, which is of course more expensive. Another limitation to POCUS MSKUS is it's highly operator dependent. Quite a long learning curve, but it is short if you kind of just learn one section at a time, such as maybe you specialize in runners and you really look at the Achilles tendon. That could be your thing that you could come up to see pretty fast if you just focus on one structure. Or the common extensor tendonitis. Okay, my training, like I said, I've been with the UC Davis Hemophilia Center for 4 going on 5 years, and I've learned how to use the ultrasound. Went to a couple training sessions, bought DVDs and books, etc. And really, you just need to practice, practice, practice. The hemophilia community tends to bleed in elbows, knees, and joints, and so that's kind of where we started, where we cut our teeth on, and then later on expanded to shoulders and hips. Like any foreign language, if you don't use it, you're going to lose it. You just need to study your anatomy before you take a very pricey, expensive hands-on course. And again, I am committed to mentoring my colleagues in this wonderful imaging art. There's lots of battles going back and forth as far as our ability to refer for higher level imaging, such as x-rays, like in the military. Maybe if you're working the Kaiser system, you can do that. But here, you are actually able to perform a mini x-ray or a mini MRI in your clinic within your practice. It's absolutely incredible. So let's look at some images. What can we see? Like I said, it's like a mini MRI or x-ray at your fingertips. You can see the edge of bones, the thickness. You can measure the thickness of cartilage. You can look at all the soft tissue, muscles, bones, and joints, tendons, synovial linings, joint capsules, bursa, even nerves, which is an amazing specialty to look at nerve entrapments. So here we go. This is my elbow. Let me orient you to this, and hopefully you can see my pointer here. Imagine the person, I'm going to use that word imagine a lot because that's the name of my consulting company. And it talks about ultrasound imaging. So imagine the person is lying supine. Left over here on the left is the head, and the feet are on this side. So imagine that. Supine, head over here, feet over here. Superficial is on top. As you go down, you could see further down into the image. So here is the tip of my elbow. Here's the tip of the olecranon, the triceps tendon, triceps muscle coming more proximally to the head. So here we have a nice smooth olecranon bone, which is hyperechoic or kind of white. And then you have the posterior trochlea of the humerus and the olecranon fossa filled up with a kind of a mixed echoes of fat pad. Here we have the triceps tendon and the all-important musculotendinous junction, which is often a source of strain, sprain, because of the what they call the vascular watershed. You see subcutaneous fat and skin. So again, how do you learn? You start with normal sonoanatomy. Through some other slides of just examples of the exquisite detail that we could see with MSK ultrasound, and feel free to drop your questions in the box. You could visualize hematomas, muscle tears. This is a panoramic view of almost the whole quadricep here of the vastus intermedius and the rectus femoris on top. A cross section of this gives you more detail that you could actually identify this hematoma is actually not only in the vastus intermedius, but also superficially in the rectus femoris with the underlying femur down here. So this is what you get. You get black and white images. The more dense the structure is, you get hyperechoic white reflection of the bone, foreign body, or prosthesis. If you have calcium deposits as well, they hyperechoic structures such as bone turn up bright white, and even if you have a calcium deposit, it will also show up as bright calcium deposits. Okay, I am going to go through a bunch of slides here, and just to give you example upon example, this is a muscle tear or muscle bleed in a gastroc. You could again see just the exquisite detail of blood coagulating. The images that you do get are black and white, and every structure has its own sonoanatomy, different shades of either hyperechoic or hypoechoic. If we turn on the Power Doppler, this is a feature that can show hypervascularization or signs of inflammation. And so in this case, it's a sign of injury, acute injury, or signs of healing as a muscle strain or tear is progressing that you could use to mark a patient's progress and recommendations to return to sport, return to work, changing your weight-bearing precautions and rehab routine.